Well, good morning, everyone. Thank you for joining us. I'm Dr. Margot Jacot. I'm the owner and director of the Juniper Center, and this is our monthly Facebook Live. Please join us the first Friday of each month when we have interesting guests who talk about various things that have to do with psychology, mental health, and wellness. And today, I am so excited. We have Dr. Saloumeh Bozorgzadeh, and this is going to be a really interesting conversation. Dr. Saloumeh is a psychologist as well here in the Chicagoland area. Today, we're going to talk about Sufi psychology. And Sufi psychology, I'm not even going to take a stab at what that is. I'm really going to let Dr. Saloumeh talk about it. But I'm so fascinated about this intersection between psychology, wellness, finding one's true sense of self through spiritual means. So that's part of what we're going to talk about. And Dr. Saloumeh has also been very involved with a project that really touches my heart, caring for our caregivers. They have given tablets to hospitals and frontline workers who have been dealing with this COVID pandemic. And the way that she helped implement this, the way the organization helped implement this for our caregivers is phenomenal. So I'd love to welcome Dr. Saloumeh. Good morning.
Hello, thank you for having me.
Well, thank you so much for joining us. And if anyone is out there listening live today, please say a quick hello. You're also welcome to put in any question you might have, and we'll be sure to get to it. So Dr. Saloumeh, tell us a little bit about Sufi psychology.
Yeah, so Sufi psychology is where you take the teachings of Sufism and you bring them into the field of essentially Western psychology, contemporary psychology. Now, Sufism is a path of self-knowledge. The entire goal of Sufism is for each person to know who they are. And when I say know your identity, know who you are, it's separate from typically, the narratives we have in our heads, the limitations based on our experiences that we've placed on ourselves, the culture, societal rules and norms and suggestions of right and wrong, our familial and religious upbringing that tells us this is good, this is bad, this is how you should be. It's really to know if none of that was there, who are you? And what is that force? Because you see, that's the empowering. Our center, that is like the part that empowers us, that gives us strength, that pulls us through, gives us creativity, allows us to have compassion and hope. And so we try to bring that into psychology a bit more so that it's not, although we use regular psychotherapy modalities such as CBT and, exposure and response prevention and other types of things. There's also an added element of not just learning how to navigate your physical dimension, as we call it in Sufi psychology, which is your mind and body and your emotions and your social relationships, but also learning to kind of reconnect with that source of strength within that pulls you through and that connects you with everything.
Oh, I love that. And you're saying reconnect. So there's an assumption that we were at one point connected to it, and somehow events or the course of life has taken us away from that.
Correct. Yes. The example that, it's fresh in my head because I was using it yesterday is I'm sure we've all seen children trying to stand up, right? And they put their hands on the seat and they pull themselves up and they fall. And then they put their hands on the seat and they pull themselves up and they fall. And it's this incredibly innate process of doing so. They just kind of pull themselves up. They know that they're supposed to, they somehow on some level know that they are to stand up, and it innately occurs. And one of the things you don't see at that age, because they don't have the ability and we haven't been taught to do so yet, is how to compare ourselves with other people and say, well, Johnny down the street was walking faster than I am, and this is never going to happen, or get disappointed when you can't get up, or feeling like I'm not where I need to be. All of these other things that we have that are really based on comparisons, just naturally being a societal and a social being, we compare. Those then start limiting and covering us up. And so what happens is then, and when we get older, it's harder for us to really know and identify what our path is to kind of to move forward, because we have so many stories in our mind and that prevent us and limit us.
So what would some of the practices be in Sufi psychology that you would utilize? You know, it's described as the science of the soul, which I love that. The science of the soul. And just listening to you talk about it, I feel really drawn to it. So what are some of the practices that Sufi psychology utilizes?
Yeah, so a lot of our practices are nonlinear. So it's not just simply talking. There might be some art, there might be movement. We use a meditative practice called tamarkoz. So tamarkoz, it is a Sufi meditation that it involves 6 different components, and they all work together in harmony to quiet the mind, to bring your being into balance, like the different aspects of you into balance. Um, and so that's actually when we talk about the tablets, the practice we have on the tablets. But so there's that practice. We use a lot of great Sufi poetry and stories that really kind of touch you. They touch kind of close to home, and they remind you that there's more to life than these circumstances. So a great quote that I use often is by Rumi, and he says, "If you're irritated by every rub, how will you be polished?" You know, and when we're working with patients, it's a reminder that all of these circumstances are the rubs, right? But what is the polish? What is that goal that you have in your life? Is it to grow? Is it to develop? Is it to, what is that part? And so reshifting the focus to that journey that each person has for themselves, whatever that may be and however that looks for them. If that explains a little bit about it.
That's wonderful. And there is science. Literally, there is science. You are, when you talk about science, you're really speaking my language. I love the science of therapy. I love the heart and the science of therapy. And Sufism also brings in the soul of therapy, which is like this other added element of psychology that sometimes really gets missed. So I love that. But you're just finishing up some research that's it's like your first year of a 3-year grant. And here is the title of the study. I think this is what it's called: The Integration of the Heart-Centered Paradigm of Sufi Psychology in Contemporary Psychotherapy Practice. The integration of the heart-centered paradigm. I love that. Can you tell us a bit about your research, what you've been doing, what you've been finding? You're at the end of year 1 or finishing up year 1. Where are you headed? What are you hoping for?
Sure. So this was really exciting. Basically, Brigham Young University got a grant through the Templeton Foundation, and it was I think a $1 million grant, a couple million maybe, I don't remember exactly. And so they set out to have the largest interdisciplinary big data project, and their study is enhancing practice-based evidence for spiritually integrated psychotherapy. Our site, Sufi Psychology, was one of 25 sites across the globe of therapists integrating spiritually integrated practices into working with clients. And so what basically happened was, for a period of 1 year, they followed our patients. So after each session, our patients would log into a portal and they would fill out questionnaires, and it was and then also the therapist logs into a different portal and fills out what interventions they used. And so we finished that for a whole year, and now we're still looking through the results and analyzing the data. But what we were essentially looking at, what was unique about this, is unlike a lot of other studies where you try to take this, as you're a therapist, this art and intuitive nature of therapy, and you try to stick it in a laboratory and like isolate things and try to determine this is causing that, and there's all these confounding variables that aren't really being taken into consideration because you can't. And so this what was unique is this was practice based. So it was a bottom up approach. It was allow the therapist to do what they're doing, and we will observe the effects. So it really, I think, allows for it to be kind of a stepping stone for future research. And so our initial results have shown that Sufi psychotherapy has resulted in a decrease of perceived stress, a decrease of distress on multiple scales, such as psychological distress, critical items such as suicidality and homicidality and hallucinations and all of that. And then there was an increase in hope and increase in resiliency. So that's kind of that was the initial results. Now we're kind of digging into them a little bit more to determine. So hopefully once we have the final results, we'll be able to say, but at this stage, this has kind of been what we've been told until we know more. But.
Phenomenal. A decrease in hallucinations.
I mean, it was critical items. I wouldn't say I wouldn't say it's a decrease in hallucinations. I was trying to explain what critical items are on that scale.
This is
and that's not really a fair thing to say because this is an outpatient practice. So I suspect most of the clients really didn't, but their critical items was a scale that included suicide, the main like suicide, delusion, homicidal, and hallucinations. And so that scale decreased. I suspect when you go back and you look at it, I don't think any of our clients really had exhibited hallucinations, but yeah. So disclaimer that.
Thank you. I appreciate that. But it could be a decrease in that whole segment, right?
Correct.
And an increase in hope, which of course it's a counterbalance, right? So if you have an increase in hope, there's a decrease in suicidality automatically. And if you were to take a guess at what helps people feel that increase in hope, which, my gosh, everybody would argue we need that desperately right now. What is that? What's helping people in Sufi psychology, in this practice, feel more hope?
I would say it is a reminder of who they are. So I'm going to give you an example. I worked primarily with really high risk adolescents. I really specialized in self-injury, eating disorder, substance abuse, and suicidality. And so this was kind of my training. And one of my clients, this is years ago, who was a young girl, she was maybe 15 at the time, actually probably younger. And she had a severe history of depression, suicidal ideation, and self-injury, a lot of self-injury. And so when I started working with her, and she was really young, she was in a developmental stage where, it's natural to feel kind of sad and all of that. And when I was working with her, after about, let's say like this is maybe 6 months into treatment, she hadn't self-injured in about 4 months at this point. And it was suicide awareness week at school. And so she was at school and they give everybody a depression questionnaire. And so, everyone fills it out. She fills it out and she ranks on the question, like at the top end. And the social worker calls her in and is concerned and says, "Are you okay? Like I'm looking at your questionnaire and, I'm really worried about you. You're sort of suicidal, you're this, you're that." And when I heard this, I would my jaw dropped to the floor. For me, it was really beautiful. She says, "Oh yeah. My thoughts are kind of in that negative place, and my instinct is to want to isolate, and I feel sad, but I know this is going to pass. And so right now I'm really focusing on my art and my music because this is just part of my mind and my emotions, and it'll go away." And I was like, "Oh my gosh!" But that.
That's fabulous.
It's amazing. So it tells you, though, that she's identifying herself as being separate from these. These are manifestations of things she may be experiencing and going through, but she's relying on something that is separate from that to determine who she is. I am not depressed. I am not this. I am not that. But these are things that are natural and I'm going through, this is happening. So I'm depressed. Yeah, it makes me sad. So I would say that if that demonstrates it, I think that is the thing that makes the difference.
That's a great example. So it's the person being able, in this case, a teenager, which this is phenomenal, being able to see that this is what I'm feeling. This isn't who I am. And I love that shift in language. And it sounds like this is inherent in Sufi psychology, but the shift in language from I am depressed to I'm feeling depressed.
Mm-hmm. Yeah.
I mean, that's a huge shift just in the way that our brains are going to process that information. When I say I am, I become, versus I feel, which is I experience. It's transient. So that's a wonderful takeaway. And I understand, Dr. Saloumeh, that this is partly how you came to psychology. You really understand teenagers in particular who are struggling with depression. I mean, this is personal to you. And so I'm assuming that that's part of how you perhaps found your way through.
Yeah, it was I had this experience when I was young. I was a teenager, and I was, teenage angst, and I was super depressed, and I was alone in my room, and it got really, really bad. I remember very clearly, I remember like suicidal thoughts. I remember just not wanting to live. Nothing mattered. Nobody mattered. And my father was, my father, he's a chemist. He's a scientist. Like, this is not his field. And he's raising a daughter by himself. And he's just like, I don't know what to do for you. And I remember he cried and said, I don't know what to do for you. And he said, can you write your Sufi teacher? Because in Sufism, you have a Sufi teacher, an individual who has gone through the path and knows kind of the ins and outs. And he's like, can you just write him? Because I don't know what to do. And so I wrote in my teenage angst this 6-page manifesto of everything I was feeling, front and back and everything. And I take it to him, and his name is Professor Nader Anwar, and he calls me into his office, and this is at the MTO School of Islamic Sufism. So he calls me into his office, and and he says, so what's wrong? And I, in that moment, I couldn't remember. And he had a stack of other letters he had to go through, and he was just reading his letters, giving me time to really think. And I was sitting there, and I was like searching my entire being, like, what was wrong? What's wrong? I couldn't remember what was wrong with me. Like, what am I feeling? What is this? I couldn't remember. And it occurred to me, like in that moment, it was such a pivotal moment. It occurred to me that if my arm was broken, it doesn't matter what the circumstance around me is, my arm is broken. It is clear, it is broken, I can point to it. The fact that in that moment, all of a sudden this angst that I was feeling wasn't there for whatever the reason may be, I realized how much of it was self-created. And so, he spoke to me and kind of explained to me a little bit more about this. This is like my first lesson in Sufi psychology, where he was explaining to me that part of it is related to my age and the hormones in my system and what I was going through. But then all this other part was me creating, right? I had just taken this and I created, and I would look at my friends, and all my friends are doing the same thing. We sit there in our brains, we sit there, we indulge in the feeling, we indulge in the experience. And then our brain has no other choice but to build upon it and to create, because that's what the brain does. So it was that moment that I was like, oh, this is so important.
Yeah, I love that. Right. And there are some folks who might say, well, I have no control over this. And I think for some people there are. And right, I mean, of course, our brains are potent things. But at the same time, there is an element of what we give attention to, what we allow ourselves to sink into, absolutely affects what we think, what we feel, where we put our attention really matters. There's a way that Buddhists talk about inappropriate attention. Don't give things that don't need it inappropriate attention, because that's your mind will follow. Your brain chemistry will follow. So I love that. So this is just kind of another way of thinking of that. Like, So that's a great story for you. I mean, you have lived this. This isn't just something that's theoretical for you. You have lived this as well and seen the transformational power. And you've used this transformational power to help caregivers. So will you please tell us a bit about your Care for Our Caregivers project? What a phenomenal project. It's here in the Chicagoland area where you and I reside and practice, and it's all over the country. So please tell us about this project and how you came to it. It's a great story.
This was incredible. So so Caring for Our Caregivers is the name of our initiative. And this began in April of 2020. So prior to this, Sufi Psychology Association was doing some work pertaining to caregiver burnout. And I don't know if you know this, but healthcare workers had the highest rate of suicide of any profession prior to COVID. So prior to the pandemic, this was a crisis. And so once the COVID hit, our concern then shifted to, oh my, like, what is this going to do to our healthcare workers if they're already burned out, right? Not only does this severely impact them, a lot of my clients are also healthcare workers, and hearing what they were experiencing, because now not only is it just burnout, but they're also worried about their own health. They're worried about how they're affecting their family. They don't know what they're fighting. They are the sole support for their patients because their family members cannot be there, and some of them at the last moments of their lives. I mean, there is so much happening. Their colleagues are, they might get COVID, and so they're off. So then they're understaffed. I mean, it's so multi-layered. So we wanted to provide them with something. So we created a tablet where we teamed up with the Tamarkoz Association. So that Sufi meditation that I was telling you about, Tamarkoz, that's been used at hospitals and at universities across the nation. And one of the things that the research on that has found when it was used with UC Berkeley students, is that it decreased the perceived stress and increased their positive emotions, even as they went into stressful times. So their positive emotions were still increasing. The stress was decreasing, even as they were going into finals week. So we realized this is a good method to use. So we partnered with the MTO Tamarkoz Association, which is the association that created, that promotes this style of meditation. And they have an app. And they were kind enough to give us the videos that they put on the app and the videos that they have available for the public. They just gave us those videos, and we uploaded them onto the tablets so that there's no Wi-Fi or any barriers to people accessing this. You don't have to log in. You don't have to sign in. You just push play, because at that point, we just want to decrease barriers. And we've been donating these tablets with individually wrapped disposable headsets to hospitals around the globe, actually. So it started in April. At the end of 2020, we were in over 290 hospitals, all 50 states, 4 countries, and still doing donations. We just did one for Mount Sinai and Holy Cross yesterday to help these caregivers get some relief in the hospital, something tangible they can turn to. They can, before or after a shift, or if it's really challenging, their coworker might be like, you need a break. They have something. Because I was just hearing that they're sitting there staring in the break rooms, just staring like nothing, in a state of shock.
Just right, exactly, in shock. Bless you all for doing that. Really, what an incredible service. I want to take a moment and say good morning to Bill Brickey. He's joining us. Thank you for your comment. And to Jeanette Dingy, one of our wonderful therapists who works with us at the Juniper Center. She's amazing. So,
and she's from California. They're watching I'm from California.
They're watching from California. They were so smart. They took their dog Nika on a road trip, but that's a conversation. It's so anyway, they're absorbing some warmth right now. So thanks for joining us this morning, to both of you. But I have been, like many people, so distressed for our healthcare workers, and we tried to offer some free services and just trying to get anybody some care. But this is brilliant. Rather than saying, well, come, sign on, you can talk to me, you gave them something they can use on a break. Break. Just or instead of staring into space in shock, they can take a moment on their break and be fed, have their souls, their minds, their bodies be fed. This is just phenomenal. I'm so excited about this, and so in awe of the fact that you've been able to make this happen so quickly. And if people want to donate, because this costs something, this isn't free. It's not like these tablets just descended from a mountain, and here they are. So if people want to donate, and there's a good morning, Nahid. It looks like we have somebody else joining us. Well, how can people donate? What can they do to help this effort?
Yeah, so there's multiple. So we've got Caring for Our Caregivers it's on the screen right now. That's our website. So you can absolutely donate through there. if you're part of a hospital that we have a list of our hospitals on the website, if there's a hospital that we're not in yet, all of this PR that we do, what's been really great is every time there's an article written about us, we get emails from like 4 or 5 nurses from all over the nation saying, can we get it for our hospital? Because we are honestly just cold calling. It is individually reaching out to every hospital. So if there's a hospital that you think needs this, them contacting us or, getting us in touch with them, that helps as well. We're more than happy to. But yeah, this is the website in terms of donating. And then the other thing I just want to say, with burnout, what's happening, what we're seeing is that, as I'm sure like when people are in the stressful crisis, their body is pulling them through, right? The adrenaline is going, fight or flight is pushing and pulling them through. It's usually when things begin to settle down that you begin to feel the impact of this. So our healthcare workers aren't anywhere near being out of the woods, nowhere near. And right now with the vaccine out, it's actually more stressful because it's more work for them now trying to get the vaccine to people. So it is like, I spoke to a nurse the other day who said she works 13-hour days, 5 days a week. As you can imagine, you go home, you don't have the energy to do anything for yourself. You barely have the energy to eat. You just want to hibernate. The research coming out of other countries shows that the healthcare workers are exhibiting PTSD symptoms. This is what they're going through. So we're not anywhere near done. And when the vaccine is here, everyone's vaccinated, they still have quite a bit of a journey to go through. And the other thing to keep in mind is when healthcare workers are stressed and they're burnt out, they're more likely to make mistakes. They're more likely to misdiagnose. So it really affects everybody on a whole.
Yes.
This is a big deal.
Big deal. So anything we can be doing, and this is one thing we can absolutely be doing, is supporting this organization. It is helping our caregivers. First of all, they have families, they're human, obviously. And so we're helping them, but we're also helping perhaps somebody we love, because we want these people to be able to be at their best when they're caring for us or our loved ones as well. So it really benefits everyone if they can participate in helping our caregivers. And I'm so glad you brought up, Dr. Saloumeh, about how we aren't even beginning to see the impact yet, because that's absolutely how it goes. They're on autopilot at this point. Their systems are on go. And it's when this crisis really begins to abate, which I'm trusting at some point it will, that we're going to see the real impact of the suffering and the trauma that these caregivers have been enduring. So thank you for doing this. I really appreciate it. And one last thought is, it kind of introduces or ties into this idea of using technology in mental health, that interface. And what are your thoughts about that, just in general, about, wow, so now we have all this technology that really can help people through all kinds of crises.
Yeah, it's interesting. I see the benefit in it, absolutely. Like, for example, with apps and even just this, like taking the tablets there. So, for example, right now with the lockdowns and everything, we're able to provide a lot of resources through technology. We have a monthly Wellness Live event for healthcare workers. February 25th, we have a Show the Love. It's a celebration for healthcare heroes where every hour on the hour, we're going to be streaming something for like a programming, either meditation or a comedy hour or something, like just something to celebrate them. And we wouldn't have been able to reach them if we didn't have this technology, right? We're out here, they're in there working, and we wouldn't have access to them. So I think it's really great. On a personal note, from a psychological standpoint, it is I find it at least a bit challenging with telehealth if I'm doing it from home. If I come into the office and I'm doing it, it's different. But when I'm working with a client from home, I feel like that separation of home and work kind of disappears. And it's almost like when I'm with a client, I feel engrossed in their experience that it almost feels like that experience is now brought into my space. And so that's kind of interesting for me to learn what that experience and what that balance is like. But
yeah. Right. So it is, and I'm so glad, Nahid, you're watching from Chicago. Welcome. It is freezing here today, literally. It's so cold. It's below zero wind chill. So Jeanette and Bill, you've made some good decisions here. So yes, the separation with technology. So it's a tool, but we have to be mindful of the impact of that as well. So for the caregivers, what a great tool. For our clients, we're recommending the Calm app, Insight Timer. They were so generous to offer some free content this year. There are YouTube offerings that people can tap into for calm, sort of nervous system regulating apps and content. And we have to remember the place that it has, that there can be a fatigue that comes from that as well. But I think what you have done with the Caring for Our Caregivers is such a great use of technology, and I'm very grateful that you've done that. And Dr. Saloumeh, so we just have a minute left, but you also have a practice here in the Chicagoland area. You are located in the St. Joseph Hospital Professional Center, from what I understand. So you work with people on a regular basis who are living this. This isn't theoretical for you.
No, and I work with the residents at the hospital as well, and doing some of the wellness workshops for them as well. Oh, thank you, Nahi. That's very sweet. As well as the oncology patients. So that practice of telehealth, as I was telling you about, we work with oncology patients here to do. And actually that group as well, if anybody wants to experience that practice, it is available. They have live sessions in 11 different languages on Instagram daily. So you can get that experience. But unfortunately I didn't provide oh, hello, Netta, thank you. So that's also an option.
Wonderful. Well, so many options for people, and you clearly are very generous of heart and spirit and soul, and wanting people to have options and ways to really heal and become whole again. So I very much appreciate you joining us today, Dr. Saloumeh. I would love to have you back to let us know more about what you've discovered in your research.
Absolutely. It would be my pleasure. Thank you for doing this, and thank you for raising some awareness for what we're doing. We truly appreciate it. So thank you so much.
You're more than welcome. And please keep us posted. Anything that you have, we would love to share with those who are interested in what is going on. So thank you so much, Dr. Saloumeh. Thank you all for joining us today. Please let us know if you have other thoughts about what you'd like to see on our show. I'm Dr. Margot Jacot, owner and director of the Juniper Center. Dr. Saloumeh, have a wonderful day. Stay warm.
Thank you.
Take care, everyone.
Bye-bye.